Hey, it's a girl Sarah. A very good morning to you. You're tuned into the sunrise with me, Sarah, right here on Relax Radio. Now, if you're just tuning in, like I said, a very good morning to you. I'm super excited to be here because we're talking about everything related to the United Kingdom, everything that's important, current affairs, health, science, technology, whatever it is. That is what we're talking about. So make sure you stay tuned to Relax Radio because I have a lot of fun things. I have a lot of information heading your way as well. Now, if you really like some of the content, if you really like some of the content that we talk about, make sure you follow us on our socials, which is Facebook, Instagram, TikTok, and Twitter. And also make sure to download our app on the Apple App Store or even the Play Store, where so you can have it on your Android or even your iOS devices. Okay. Sometimes I get very confused with the operating systems and in devices, so I'm not that great at technology. Sometimes it gets really confusing, but that is what that's about. But stay tuned because I'll be talking about whether the flu will actually be a bigger problem than COVID-19 in UK this winter. Now, this is something that a lot of medical experts out there have this is a concern that a lot of medical experts out there have actually been talking about. They've been voicing their concerns and their opinions because they think that the flu could potentially be a bigger problem than COVID-19 because of our low immunity and because of the fact that we've been stuck at home for a really long time. So we'll get into that. So if you have any questions, if you have any messages, thoughts, opinions that you would like to share with us, make sure you text me on 078 because you can actually, I would love to hear your opinion because I would love to hear what your thoughts are on this, and what exactly you think that needs to be done to make sure that the flu doesn't become a bigger problem than COVID-19. So like I said earlier, because of the pandemic, and because of lockdown as well, we've all been stuck at home, right? Which means we've all been spending a lot of time at home, and obviously that is because we're not allowed to go out. That's why it's called a lockdown. So and even when we do step out, even those few times when restrictions were eased, before we came into the second lockdown and everything, we've had to take additional precautions when we step out. And these were, the basic things they tell us, like wear your mask, socially distance, and sanitize your hands, right? But the thing is, a lot of this, and I was telling you this yesterday as well, you know how you've seen so many memes about, or even tweets where people have said, hey, look, it's so surprising that a lot of us haven't gotten sick. And someone else replied to that tweet with, hey, look how much change you can make when you're actually, when you take safety precautions and you keep yourself, safe, and when you keep yourself away from all these germs, right? And at that point, it was actually quite funny because we were all trying to be very positive. We were trying to have a positive attitude about the lockdown. We were trying to have a positive attitude about the pandemic because of all those uncertainties that we faced, right? So obviously, because of that, when a lot of us have been stepping out, we've been taking this additional precautions, we've been taking additional steps. So because of that, we've all been much safer and we've reduced the risk of contracting the flu. Because when you're wearing masks, when you're constantly washing your hands, then that way you're ensuring that no germs can actually get into your body, that no germs can, or even if there are germs on your hand, you're constantly sanitizing, right? So those germs are always killed and you're always making sure you're safe. So because of the low prevalence of the flu during to the pandemic, it may have actually led to a drop in immunity this winter for the population. And that is what I said, because when you're being safe, when you're being, taking all these extra precautions, you're actually keeping yourself away from all these germs and away from all these viruses. And the thing is, that might have actually dropped the immunity that we have, because like I said, when we're constantly being exposed to these viruses, or obviously not something as serious and scary as coronavirus, but you have all these other viral flus that are there, especially during certain seasons, during summer, spring, whatever season it is. You have certain different seasonal flus that are there. So obviously these flus have actually when we're exposed to them, our body actually creates a lot of immunity, because our antibodies start recognizing it as something that needs to be destroyed or eliminated, and they start fighting it, right? And sometimes you don't get the disease because of how active and how strong your immune system is. Now, because we've all been stuck at home, because we haven't been able to go out, and we've all been in isolation a lot. Our immunity system actually has reduced working the way it has, because when we're at home, we're breathing much cleaner air. We're much more safer, we're much more healthy when we're at home. So because of that, it means that our immunity systems haven't been active the same way it was. And that is why a lot of health experts out there are saying that the flu could actually be a bigger problem in the United Kingdom, other than in addition to COVID-19, this winter. So it could be much bigger than COVID 19, actually. And this was actually said by a senior government vaccine advisor, who also said that because of the low prevalence over the past months, it could possibly lead to a drop in the immunity among the population. Now, Dr. Anthony Harnden, who is the deputy chair of the Joint Committee on Vaccination and Immunization, said that research was being carried out on whether flu vaccines could be given alongside coronavirus vaccines this autumn. So they're considering that possibility as well, whether they could have flu vaccines and people could get vaccinated against against the flu, to make sure that everyone is safe, and that the National Health Service doesn't have an additional burden and doesn't have to work, overwork themselves so much more than they are doing right now, because of coronavirus, right? And he also said that we've had a very, very low prevalence of the flu for the last few years, particularly during lockdown. And we do know that the flu has been circulating in very and we know that when the flu has been circulating in very low numbers, the immunity really drops in the population, and it comes back to actually affect us. It comes back to make things so much more bad for us. So flu can actually be very, very important this winter. And that is why all these health experts, these professionals, are trying to find ways. They're trying to be so much more smart. They're trying to be smarter with the way they vaccinate people, with the way they address problems, especially if there's a flu, right? Now, the thing is, decisions also need to be taken quite fast, because it's almost July. I was telling this to my sister yesterday. It's so crazy how soon time has passed. Like, it almost feels like January was yesterday. And we've already, it's like we've passed 6 months of this year. We're in June, and in like almost a week and a half it'll be July. So it's really crazy how soon the time has passed. It feels like it was just January, February, March, and then suddenly we're in June. Like, what happened to April and May? Didn't those months exist? So we need to take these decisions very fast. We need to take it soon, simply because the flu season is approaching, winter is approaching, because we're already in July. So there is a lot of concerns that these health experts have, and they also want to check and actually make sure if they can have these vaccination programs for the flu and for COVID-19, if they can have it simultaneously, or if they can even use the same vaccine to sort of help you from getting from not to prevent you from getting the flu, or to reduce the impact that the flu would have on you if it does in fact turn into a much more serious condition. So these are a lot of the questions that they're having. These are a lot of the things that they want to solve. So that is something that we need to be focused about as well. So while you're here, I'll actually keep you entertained. I will tell you, or rather, I will keep you informed about the flu season. I will also make sure I let y'all know some steps, some extra precautions that you can take in case, or to keep you safe from the flu, and what actually you can do just in case you do get the flu, and how you can make sure that you're safe, you keep yourself protected, and also the people around you protected, especially because flu season is approaching. Okay, it sounds like the name of some really sci-fi movie. Flu season is approaching. I mean, that's probably not the name, but that would be like the tagline of it. But that is what I'm talking about. So make sure you stay tuned. because we do have a lot to talk about. We do have a lot to consider, especially when it comes to flu season. There is a lot of precautions that we need to take as well. So make sure you stay tuned, because right now I'm going to head into a little break. But I will be back to actually talk about how our immunity has dropped during the pandemic, how we can actually deal with the flu, and the extra precautions that we need to make sure that all of us are safe, especially during these times when we're battling a lot of diseases all around the world.
And it gives them something to look at, and it makes them laugh. It makes them laugh. So that's why I do it.
Oh, and it could be a really good pickup line as well. Ladies who ask, "Hey, excuse me, so why are you wearing something so colorful?" I mean, hey, you can always have something up on your sleeve. I mean, got me thinking. You want to stand out. Why do you want to stand out though so much, especially with these kind of shirts when you're riding? There must be a purpose behind it, right?
Well, when you say a purpose, Nick, what I do, I wear the shirts, and mainly one, because they're nice and bright, so they make me visible, especially if I'm riding on the road.
Okay. Yeah, that's very important, right? Because you want cars, yeah.
Very important. And also, like, people see me in like calves, and perhaps I shouldn't be saying this on air, I suppose, but in the bar afterwards.
All right.
And it gives them something to look at, and it makes them laugh. It makes them laugh, so that's why I do it.
Oh, and it could be a really good pickup line as well. Ladies who ask, "Hey, excuse me, so why are you wearing something so colorful?" I mean, hey, you can always have something up on your sleeve. I mean, you look like a guy who would do.
You know me too well. You know me too well, Nick.
The valuations that you place on an asset are always behind you. It's always in hindsight. It's never in front of you. And that's one of the challenges, right? Because you're always valuing what happened yesterday. And what you need is what's going to happen tomorrow. What am I saving or investing for? Why am I doing it? When will I need the money? And how much money do I need? Yeah. So that's quite important, because when you're looking at your net worth, you've got to start with saying, well, what do I want my net worth to be, so that there's a goal, and then work backwards. How do I get there? And if I can start with £50 or $50 a week, if I save that every week, and you can go online and use calculators online. I don't have to teach you the maths behind it, but you can say, okay, and if I get a 3% return and I put this away for how long will it take to reach my goal? And that's called just this basic cash flow projection calculations. And it's what we use in financial planning all the time. What we say to clients is we say, okay, what is your goal? What is your objective? Where do you want to go to? And we discuss that in a lot of detail and over most of the meeting. And then the rest of it is saying, okay, in your exact circumstances, with your risk profile, with how you feel about investments and pensions and taxes and where you are and who you work with, and your education level or your lack of education or how involved you want to be. There's a lot of variables that we take into account, and then we say, okay, here's a plan. You start like this, that's great. And then we review it all the time. And we say, okay, we need to increase it, we're on track, we're not, this is what is happening. Because remember, when you're dealing with assets, the valuations that you place on an asset are always behind you. It's always in hindsight. It's never in front of you. And that's one of the challenges, right? Because you're always valuing what happened yesterday, and what you need is what's going to happen tomorrow. So that's a struggle. Yeah. So there are strategies everywhere from £50 a week up to £100 million, and they're different, right? They range differently from everyone, but and from country to country, to be fair. Different countries have different tax laws, so different vehicles. But from your point of view, at the sort of normal end, I'm not going to call it the low end because I'm in that boat as well. It's as tax efficient as you can get it. That's where you start. You use all the tax efficiencies, and then you step up into different things.
Hey, it's your girl Sarah right here on the Sunrise. Now, you tune into Relax Radio, and we're talking about if the flu can actually be a bigger problem than COVID 19 this winter. Now, winter season is approaching. It's almost, we've already passed like 6 months of the year, and like I was saying earlier, it's so crazy how soon or how fast time passes, right? So that is what we're talking about today. We're talking about the flu season. We're talking about how soon these decisions need to be taken and what sort of decisions we need, the government and all these health experts need to take, with regard to the pandemic and with regard to the flu season that is approaching us as well. So, like I said earlier, a lot of our immunity has dropped, because of the pandemic, because of all the changes that we've had to go through, because of the fact that we've been stuck at home, especially due to this lockdown. Our immunity has actually dropped as well. So, because of that, there is a lot of doubts, there's a lot of uncertainties when it comes to our immunity rates this flu season, and that's what we'll be talking about. So let's get into it. But actually, before I get into it, if you have any questions, if you have any messages, opinions that you'd like to share with us, make sure you text me on 078 and then I would love to hear your opinion on it so I can share it with everyone else who's tuning in as well. So let's talk about COVID-19 and and all these flus. So we obviously understand that we will have to live with the COVID virus for a long time to come, and we that means that we'll also have to eventually build a long-term set of defenses, as we've done with the influenza, right? And obviously that is because eventually, sooner or later, we need to get used to the fact that this exists, that we but even though it exists, we still need to move forward and make sure that we can continue to have essentially we could continue to have normalcy as much as possible, because we need to somehow get back to the life we used to live, because we can't be in a lockdown forever. It's going to take a toll on the economy, and it already has, but it's going to take a toll on everything else as well, because you can only be stuck at home for so long. It's definitely taking a toll on our mental health as well. So like I said, it's very important that we learn to live with the virus for a long time, because it's going to take a long time for us to get to know about these things. It's going to take a long time for us to eventually figure out everything that we need to do with it as well. So because of that, because we need to live with the fact, we need to actually have a sustainable approach to COVID vaccination, and it means that it needs to um, enable us to actually trust our general physicians, and trust that the people we trust and actually represent to carry on vaccinating whilst meeting the other pressures they face, right? And that needs to happen, because we need to make sure we can believe the people who are vaccinating us, that no matter what happens, they will still continue vaccinating us, especially not just because of COVID alone, but also because there are so many other diseases that exist as well. And probably, hopefully, I really hope not, but there could be other diseases that we don't know about yet as well, right? And this means that it actually poses a large number of questions, including how long immunity from the initial double dose of COVID vaccine lasts, right? And that also means that we need to figure out if we need booster shots, and when you're giving booster shots, whether you can actually mix up a few vaccines to give booster shots, or if it just has to be the same vaccine that you were initially vaccinated with. And it also means that we need to address how vaccines can be altered to address new virus variants that could be incorporated, and even whether flu and the COVID vaccination campaigns can actually be safely combined. So, obviously, there is a lot of questions, there is a lot of things that we need to talk about. There is a lot of uncertainties that exist for all these scientists and health experts as well. And that is why we still need to continue researching, especially into COVID-19, but also to other flu variants, or even other flu types that could be around, especially during the time that is there to come. So obviously we need to understand that we can't actually start any booster or revaccination campaigns until all of these questions have answered, and it's going to take some time. But the thing is, it's very important that we figure out what kind of decisions we're going to take when it comes to winter, because winter is soon approaching, and these decisions need to be taken by September to make sure that everyone can be safe, and everyone can be protected, especially if if more people start getting the flu and more people start showing severe infection from the flu. So we know that science is the only thing that's actually going to help determine who gets what and when. But with the flu campaign that is due to start in September, decisions, like I said before, decisions need to be taken soon, because a flu campaign is going to start in September, and it's already, July. It's almost July, so we need to make these decisions as soon as possible. Now, Martin Marshall said that they also need to dig into what a vaccine program would look like for an endemic condition when we're outside of this crisis mode that we've been in for the past 6 months. And this crisis mode obviously is the fact that is this whole crisis that we're dealing with right now, the pandemic, how we're gonna how we're gonna get back to normal after it, and what kind of future we would actually have, especially if we're talking about life after the pandemic. How do we adjust ourselves? How do we make ourselves immune to all the other diseases, to all the other flus that exist, and that we don't know about? So one thing we need to know, the first thing that we need to know, is whether a booster vaccination program is needed. Okay, because something like COVID, it looks like, and research also points to the fact that it might be there for a long time. However, it's uncertain as of yet, but that is what it looks like. And because we don't know how long this will last, and we aren't exactly sure if this is something seasonal, then obviously we need to consider things like booster vaccination programs, right? And even if it is needed, then what kind of populations do exactly need it? Is it people above 60 years of age? Is it people who are just above, who only people who are 18 years of age, or whether the whole population needs these booster vaccination programs? And we also need to know that where it will be given, and how it will be given, and by whom it will be given. So generally, right now, the way things are the way things are happening right now, in general practice, 3/4 of the vaccines are actually given by our general physicians and our nurses, and they're exceptionally busy, especially with the fact that there's still a certain number of COVID patients here in the United Kingdom, and that they need to, not general physicians, but all these, all the medical staff is full hands on involved in this operation, because they need to actually take care of COVID patients. They need to make sure people are vaccinated. And like I said before, COVID-19 isn't the only disease that is there right now. There are a lot of other people with a lot of other diseases, like heart conditions or cancers. There's so many different diseases out there, right? So obviously, they're very busy right now as well, especially because of the vaccination drive that's happening, and how people are getting vaccinated. So because a lot, because our doctors and nurses, they're very busy doing what they're doing, then can we actually afford to place another burden on them, and ask them to vaccinate people for the flu as well, right? And there's also that other question of whether we can actually have trained non-clinical people giving vaccination, helping with vaccination, right? Which actually might even help to address this whole influx of work that the National Health Service and all doctors and nurses have to deal with, because of the situation right now. So because all those questions are there, because all those doubts exist, that is something we definitely need to talk about. And something else that we need to keep in mind, that or the government needs to keep in mind moving forward, is the fact that we have to have sustainable solutions. We have to have sustainable ways in which we can protect ourselves and our families from the pandemic, right? Or from COVID-19. And what I mean when I say sustainable isn't necessarily just the environment. I'm saying when it comes to how often we require vaccines, or how often the vaccination process needs to take place, and what kind of vaccination are we talking about? Is this going to be a forever thing? Do we have to get ourselves vaccinated every year? Things like that. We need to have a sustainable plan. We need to have some form of development, some form of research as well, that properly looks into it and discusses it as well. And like I said earlier, because there are so many questions, because there's so many doubts about the pandemic, because so many things haven't been figured out yet. Like I said, it's only 1.5 years into the pandemic. There's still so many things for us to find out. There's still so many things for us to research as well. And because there is a lot of things for us to research, because there is a lot of things for us to, invest our energy, our resources into, to find out more about the pandemic, and all these uncertainties that we have, it's going to take some time. But we also need to make sure that we continue doing it, because like I said again, there is a lot of uncertainties. And the only way we can get rid of these uncertainties, the only way we can move forward and try to get back to normal, try to, get back to the way our lives used to be, is by answering all of these questions. And it's very, very vital that we try to address these issues as soon as possible, because the longer we wait, the harder things are going to get. And I know when it comes to vaccination, when it comes to all this research about viruses, it's hard to do it quickly, because as it progresses, you can find different variants, you can find different evolved strains of it, which is what is currently happening right now, right? We have the Delta variant, we have different types of variants that are being found, that are where we see the strain of the COVID-19 virus being evolved with every wave. So because of all those questions, and because there is a lot of uncertainty, we still need to keep researching. And another issue, or another question that we that all these health experts and professionals have, is the fact that is if we can continue, or if we can simultaneously vaccinate people for COVID-19 and for the flu. Now, this means either having two different types of injections for vaccinations, rather, for the two different two different types of flu. But it could also mean sometimes combining some of these it could mean combining some of the vaccinations that are there. For example, maybe there is a way that we can combine the antibodies that are needed for flus, for the flu, and also for for COVID-19. So if we can combine these viruses, if we can, not viruses rather, but if we can combine the sort of medicine that we give for these sicknesses, then that means life will be relatively much more easier for all the people, or even these doctors who have to handle this as well, right? So that means there is a lot of doubts, there is a lot of questions that need to be answered when it comes to the flu season, the decisions we need to take, and how soon we can make these decisions. So it's very important that we keep researching. It's very important that we continue to look into these things, because like I said, you can't just give up. And the fact that there's a lack of information because we're still in the process of conducting research doesn't mean that there is a lack of harm, right? And for you to make informed decisions, you need to have research, especially when it is situations that involve things like a pandemic, things like a very infective and serious virus like coronavirus, but also even other flus that, or other even the flu. The types of flu that exist, and how we can actually try to solve all these problems that our governments and our people have as well. Now, make sure you stay tuned, because because next, actually, I'll be talking about the ways in which we can prevent the flu and how to exactly deal with it if you get it. So make sure you stay tuned, because right now we're going to head into a small break, but stay tuned, because right after that, I'll be here to talk to you about flu season.
Now, there's a lot of conversation around who pays more taxes, if it is the rich or if it is the poor, right? But when you are basically going out and during a day, you go to a restaurant, you have to pay taxes there. If you buy a car, you have to pay taxes there. So why is it even a conversation that, the rich pay less taxes, or the poor pay more taxes? Why is it a conversation like that?
Because it's true, the rich generally pay less tax. A rich person walks into a Tesco's or a Sainsbury's, they're not going to get a different bill than another person, right? They're still going to pay the same VAT on those goods, they're still going to pay the same thing. So that's all the same. However, the differences come in if you can pay yourself from your own company, you can structure it in a way that you pay less income tax through paying a bit of salary, paying dividends, and so forth. And then also deferring income. Also, your pension payments or contributions can be different. So that increases your tax sort of gap, if that if you want to use it that way. Where a PAYE person just gets paid salary and bonus. And now those are the most highly taxed sources of income in the UK, definitely, in the UK. We've seen it, right? If an owner of a large public traded company does something wrong, irrelevant of what that company does or how valuable that company is, the stock generally falls into a pool of nothing, right? Because in a public company where the stock is traded openly on the stock exchange, the value of that stock is driven by supply and demand, it's driven by emotion, it's driven by news, it's driven by quite a lot of variables over and above the actual accounting or total net worth of that company. I mean, we've seen it, right? If an owner of a large public traded company does something wrong, irrelevant of what that company does or how valuable that company is, the stock generally falls into a pool of nothing, right? And the company may still have value, it may still be doing quite a good things.
Again. But now, if you say to a child, if I went up to a child and said, "You've had one to forget," God, there'd be an inquest. Me, why did you reject my son? Oh, I haven't rejected your son.
I want to talk about, how the generation gap, how much has changed, especially when you check the youth nowadays in comparison, to people back in the day.
I'd say when I was younger, it was more disciplined. Not now.
In comparison to now.
Not at all. Not now. The way things are nowadays, the younger generation, you seem that they can't accept the word no. If that makes sense. They can't
accept rejection, essentially, is all you're trying to say.
Yeah, they can't accept the word no. So if you, how did I do? Or you didn't do very well. And they get upset. And when I was a youngster, my father used to say to me, because I used to be sport mad when I was very young, well, I still am sport mad, but like participating in different sports. And if I had a bad game, for example, he'd say to me, "You had one to forget." That's it.
Your dad sounds like a smart guy. I mean, yeah, that's the real fact of the matter, yeah.
He'd say to me, "You had one to forget. Get over it." And that was it. So I'd dust myself down and do it again. But now, if you say to a child, if I went up to a child and said, "You've had one to forget," God, there'd be an inquest. Me, why did you reject my son? Oh, I haven't rejected your son. Or daughter. I've just told them that they need to buck their ideas up.
That's the truth right there. I mean, if you think about it, if you check the generations, like right now in the US as well, I've seen a lot of these things as well. In the UK, you get medals for participation. But what's the point? What are you trying to? Yeah, what's the point? Either you win or you lose. People are so afraid to put that whole notion of losing. When it comes to right now, the generation gap is just crazy. How much. A lot has changed. Social media has taken control of our lives, and we don't even realize it anymore. We're crippled because of it.
That's absolutely right, Nick. Because, as you said, nowadays it seems that you get rewarded for failure. For the life of me, Nick, I can't get my head around that. Perhaps I'm just getting old and morbid. I don't know. I just can't get my head around how you could be rewarded for failure.
It's your girl Sarah right here on the Sunrise. Now, a very good morning if you're just tuning in. I'm here to keep you company all the way until 9. And welcome to the second hour of my show. Now, I'm super excited to be here because we're discussing something that is very important. We're talking about if the flu this year will actually be a much bigger problem than COVID-19 in the UK during this winter. So that is what we're talking about, and that is something that we really need to pay attention to, or something we need to focus on, because levels of immunity have dropped because we're still in the process of trying to figure out COVID-19. Even in terms of vaccinations, even in terms of needing a booster vaccination, there are so many questions that are yet to be answered. There are so many uncertainties and doubts that we have about the way we can process in the future, about moving on and trying to get back to normal and with our lives. And there's also so many other questions, like how do we actually find sustainable ways in which to make sure that we live with the virus, because it's going to be there for a long time. So we need to learn how to live with it. So how exactly are we going to do that? What steps need to be taken? Now that's what we were talking about earlier, and we were talking about all these questions and doubts that are there by all these medical professionals out there, and why it's very important that we try to answer these questions before flu season begins, because decisions need to be taken. Now, right now, I'll be talking about ways in which you can prevent the flu. Now, if there are any other ways that if there are any other thoughts, opinions that you have in ways about ways in which you can be safe, make sure you text me on 078 52 473 473, because you can be a part of this conversation. You can contribute to it as well, because at the end of the day, we're talking about your safety. We want to make sure that, we prioritize you, so we want to make sure you're safe, and we want to make sure that you are always protected and safe. Okay, so let's talk about the ways in which we can prevent the flu. Now, obviously, the single most efficient way to prevent the seasonal flu is to just get vaccinated every year. But good health habits also always help. Now, one thing you can actually do is actually avoiding close contact with people who are sick. Now, this is something that we've learned from my experience of this pandemic as well. If you feel like someone's sick, if someone is showing symptoms of being sick, well, make sure that you stay away from them, that you avoid contact with them, because chances are, things like the flu, they're very, very contagious. They're very infective, which means that if you are in close contact with someone who has the flu, then chances are you're going to get it as well. And we've seen that here with the coronavirus as well. So if you know someone, if you yourself has the flu, then make sure you avoid contact with people, and make sure you try to keep away from people as much as possible. And another thing you can do is obviously staying at home when you're sick. Now, this is something we've done for the entire year last year, and even almost this entire year as well, or at least up until June, a lot of us have been in lockdown, right? And one thing you can obviously do is staying at home. And obviously, I know staying at home sounds like the most boring, annoying thing to be doing, because we've been doing that for ever since the pandemic began. But the thing is, when you stay at home, you actually prevent possible infection. You contribute to everyone else's safety, and you contribute to the fact that you don't also add an extra burden on the National Health Service, because, like I was saying, it's very important that we think about them as well. It's very easy, it's all fun and games for us to go out and have fun, but when we do get sick, at the end of the day, we're the ones who suffer, right? So if you want to make sure you're safe, if you want to make sure your family is safe, then you can keep yourself safe by staying at home. And another thing that we also need to keep in mind is the fact that it's something very considerate and thoughtful that you can do by making sure you stay at home. It's just the fact that you don't contribute to the additional burden, or to the burden that the National Health Service is already facing. So if you're planning on going out as soon as lockdown is lifted, if you want to, I mean, unless it's absolutely essential, try to stay at home as much as possible. And if you're required to come to work, if you really have to go to the supermarket or the groceries to get what you need, well, then sure, do that. But make sure while you're doing it, make sure you wear your mask, you stay safe, and you practice all those preventive measures that we've been asked to practice, which is things like social distancing, sanitizing your hands, and wearing your masks. Make sure to do that. Now, when you stay at home while you're sick, you can also, or stay when you stay at when if you're sick and you're staying at home, then that will also help to prevent spreading the illness to other people. Now, another thing is to cover your mouth and nose, and I know some of us are so excited, we can't wait until we can take our masks off. But if you actually think about it, in the long term, masks can actually be helpful. And if I had to choose between wearing masks forever or not having to wear a mask, I would definitely choose to wear masks, because it's so much more helpful, and it's healthier as well. Let's face it, sometimes at the beginning it was very uncomfortable. It was very uncomfortable, it was always so itchy, and especially if you have very sensitive and reactive skin like I do, then every time you wear a mask, you have all these pimples, you have acne, you have so many things happening and going on in your skin. But the thing is, if you can wear a mask, then continue to do so, because when you cover your mouth and your nose, then the air you breathe and the germs you inhale are actually are very less, because it comes through the filters of the mask. So make sure you try to cover it up as much as possible. And also, if you are when you're sneezing or you're coughing, just make sure you use a tissue. Just have some manners. That's how we would say it. Don't be very gross and not cover your mouth or your nose when you're sneezing, because it's gross, and also because you're going to put a lot of other people in risk. So make sure you do that. But others things like, you can also get sick when you don't cover your mouth and your nose. You can get sick from a lot of other serious illnesses. Okay, and I'm not just talking about the flu, I'm talking about serious respiratory illnesses, like the respiratory syncytial virus, which is RSV, or even the whooping cough. So, and COVID-19 as well, which is very, very important, because those things are spread by by coughing, they're spread by sneezing, or even unclean hands, because it's basically these tiny droplets of air that we inhale, that we accidentally touch, because we don't know. So always make sure you take those extra precautions and stay safe. Now, another thing you can actually do is clean your hands. Now, this is something we've been told ever since the pandemic began. Just clean your hands, wash your hands. And these are the same things that you can do, especially if you want to prevent yourself from getting a virus. Or getting a flu. So the moment you step out, the moment you come back into the house after you've gone out, wash your hands. Put all your clothes into to the washing machine or into the laundry basket, the clothes basket, whatever you call it. Just put it there and make sure you shower. Because it's going to wash off and get rid of all those germs that are there. And especially when you're out and you can't wash hands because you don't have soap, well, make sure you keep a sanitizer with yourself, preferably an alcohol based hand sanitizer, because they're much more effective when it comes to killing germs and killing these microorganisms that we can't see on our bodies. And one thing you need to keep in mind is that clean hands save lives. Okay, so make sure you keep your hands clean all the time and avoid touching your eyes, nose, and mouth. Okay, this is something very common. We're constantly touching our eyes, we're constantly touching our noses and our mouth, because, like, every time your hands are working, when your hands are gesturing, you always want to touch, like, your mouth, your nose, your eyes, right? That happens unconsciously. Not unconsciously, but you don't purposely do it. It's not intentional, it just happens. It's almost like a reflex, but it's not a reflex, if you know what I mean. So make sure you avoid touching your eyes, your nose, and your mouth, because germs are very often spread when people touch when a person touches something that is contaminated with germs, and then they touch their eyes, their noses, or their mouth, then it tends to spread to the rest of the body. And that's why it's very important that you have clean hands, and as soon as you touch a surface, like, sanitize yourself, because you don't know if that surface is contaminated or not. So it's very important that you continue keep sanitizing yourself if you do touch somewhere, somewhere that, if you do touch somewhere. So you can also practice other good health habits that will actually help you improve your health, which is something like cleaning and disinfecting frequently touch surfaces at home or work or school, whatever it is. It's very important that we continuously keep disinfecting these places, because at the end of the day, we're not sure where we've been. We're not sure the places the rest of our family members have been, right? And sometimes they might be forgetful and not wash their hands, or they might be forgetful and not really have a shower, so things like that. So when you're at home, just make sure all these places everyone touches quite often, like, sometimes it's the kitchen top. Everyone is always in the kitchen, especially in my family. How we all have, like, you have the living room for the family to hang out, to watch movies. We all hang out in our kitchen. So we're frequently there. So make sure you sanitize places like that, or you disinfect places like that. And make sure to do that, especially when someone is ill, because that's when there's a higher chance of everyone else getting ill as well. And make sure to get plenty of sleep. This is very important. A lot of us are sleep deprived. A lot of us have other, sleep deprivation conditions like insomnia, where we find it very hard to sleep, right? So try to get as much sleep as possible, because sleep is very important. It helps you rejuvenate. It helps you, it gives your body a rest, right? And rest is very important. Forget about all that hustle. Forget about that, earning so much of money and working 24 hours a day. That is not healthy for you. So, make sure that when you're sick, or make sure you try to, it doesn't even matter if you're sick or not, just make sure you get enough sleep. And make sure to be physically active. Exercise, it doesn't even have to be like an intensive workout. It can just be a few squats. It can be a little bit of yoga, a little bit of meditation. It can be a little bit of weights, something. But just make sure you're physically active, and learn to manage your stress, which is very important. And we've spoken about this, and I've told you some ways in which you can manage your stress. Making to-do lists, allocating, or rather, focusing on the tasks that you need to complete, and making, putting, when you know what time your personal peak hours are, or when your personal peak productivity is, use those times to do the most stressful tasks. So you need to manage your stress. And another thing you can do is also to drink plenty of fluids, and drink as much water as you can. It's important to stay hydrated, and you eat a lot of nutritious food as well. It's very, very important you do that, because that will actually make sure that you're healthier. It means you're encouraging yourself to have healthy habits, and that is very, very important. So make sure you do that. But stay tuned, because I'll be back in a few minutes to talk about what we can do if we get the flu. So make sure you stay tuned for that. But right now, let's head into a little break.
Climb Mount Everest. That is one of that's in my bucket list. You're laughing, but that is the facts right there. I'd love to do that. That is something I'm looking forward to do, hopefully.
Climb Everest.
Mount Everest. I mean, okay, not the very tip of Mount Everest, maybe the base camp at least.
They're talking about mental health. Well, if you went out and got some exercise in the fresh air, that will improve your mental health. It will make you feel better.
That's true. That is true. I wholeheartedly agree. But then for some people, it's, how do you find the motivation to, especially when it comes to riding a bicycle, to do it again and again and again and again? It's a cycle that you have to be used to. How do you do it? What makes you wake up in the morning and decide, hey, I'm going to pick my bike up today. I'm going to cycle. What makes you want to do that?
What makes me want to do that?
Yeah. What do you like? What could you give listeners, like people listening in right now? What kind of tip could you give them?
Well, the first tip I would give them, if you haven't tried it before, try it. It can open up new horizons. It will make you fitter. It will definitely make you fitter. Cycling is one of the best forms of aerobic exercise you can do.
It sounds like, if you think about it, yeah, it sounds like great fun. Because what essentially you're trying to say is also at the same time, when you, if you look at it from this perspective, with regards to mental health, especially when you look at it with mental health, this is another way to fight it. I feel like you go outside, you meet more people, you interact with, socially, you will interact with more people, and you're keeping fit, you're making connections, you're breathing in the good and exhaling the bad. I feel like that's a great thing right there.
Absolutely. Yeah, you got a better way with words than I have, I'll tell you. But you're quite right. What you say there, quite
I mean,
right.
I've been doing this for quite some time. I mean, hey, you'll get the hang of it.
Yeah, I've been doing it for about 10 minutes now, so yeah.
That I can never really understand people staying in one room the whole day when you can have the world to see. I am a traveler. I travel. I love traveling. Traveling is just one of the things I do. And yeah, on top of my bucket list was, to one time, hopefully when I get there, go to Nepal and climb Mount Everest. That is one of that's in my bucket list. You're laughing, but that is the facts right there. I'd love to do that. That is something I'm looking forward to do, hopefully.
Climb Everest.
Mount Everest. I mean, okay, not the very tip of Mount Everest, maybe the base camp at least.
Base camp, yeah.
At least.
Would you be able to cycle there?
Oh.
Well, good morning. Welcome to the show. It is your girl Sarah right here on the Sunrise, and you're tuned into Relax Radio, and we're talking about ways in which we can actually, or what we can actually do if we get the flu. Because we were just talking about why it's so important to actually take certain decisions. Because right now the flu seems to be could potentially be a bigger problem than COVID-19 during this winter. So that's why we're talking about steps you can take, things you can do to actually make sure that you and you are safe during this during the flu, and also the steps that you can take if you do get sick, what you can do, how to deal with it, and what needs to be done. Now that's what we're talking about. So if you really like the content that we have here, make sure you follow us on our socials, which is Facebook, Instagram, Twitter, and TikTok. And make sure to subscribe to our YouTube as well, because you can check out all the live videos, all these different topics that we talk about. You can check it all out on YouTube as well. So make sure you do that, because it's definitely going to help you and it's definitely going to keep you informed. And if you're not too much of a social media person, well, you can always download our app on the Android, the Apple App Store or the Play Store. Like I said, I always get confused with these things. And you can have it on your devices as well, so you can always tune into the show and keep yourself updated on everything that is happening right here in the UK, but also all around the world as well. So we'll get into what we can do if we actually get the flu. So most people with the flu actually tend to have the mild illness and don't necessarily need medical care or even antiviral drugs. But sometimes if you get sick with flu symptoms, in most cases you should the best thing to do is actually to stay at home and avoid contact with people as much as possible, unless it's to get medical care, and which then obviously you don't really have a choice, which then you actually have to go near a doctor to get the necessary medicine that you need. So make sure to stay at home as much as possible. But however, if you do have symptoms of the flu and you are in a high risk group, so maybe you have some pre-existing conditions like heart disease or other diseases, or you're worried about your illness, you can always contact your healthcare provider, and you might sometimes need antiviral medication to actually treat the flu. Now, we'll talk about why antiviral drugs or antiviral medication is actually helpful. So, antiviral drugs are actually used to treat the flu, because it is it's basically what your body needs to fight against the virus that is there in your body. So there are different types of no, one thing that needs to be understood is that antibiotics and antiviral drugs are very different. There's a huge difference between them. And flu virals are basically, or rather, flu antivirals are basically prescription medicines, things like pills, liquid, intravenous solution, or even an inhaled powder. And what needs to be kept in mind is that you cannot ask for them over the counter. They're not available over the counter. You need a prescription to actually get antiviral drugs. So what antiviral drugs do is they actually make your illness milder, and it makes and shortens the time period that you are sick. And it can also prevent a lot of serious flu complications like pneumonia when you start treatment early. And that's why, as soon as you feel like you're having these flu symptoms, that you get yourself diagnosed and you get medicine. If you're in one of those risk groups, if you are someone that is very worried about your condition, it's very important that you get the antiviral medicines or the drugs that you need to make sure that that you can prevent complications from happening, because the earlier you take it, the better it is for you. So it's very important that you take it early as much as possible. And another thing is, people actually have a greater chance of getting serious age flu because of age or high risk of medical condition. So if you're one of those people, if you belong to one of those groups, then make sure to always consult a doctor and try to get this medicine that will actually help you. Now, if you get sick, what you should be doing, I'll actually be telling you what you should be doing, because you need to be able to know what to do, or you need to have an idea of what exactly you need to do, especially if you're going through the flu, or if you have to stay at home. So one thing is, you have to take antiviral drugs, and that's only if it has been prescribed by a healthcare provider. Like I said before, it's not available over the counter. You can't make the decision to get the antiviral drugs, because there are so many different types of it, and there's also there's these different types actually cater to different complications. So it's very important that you take these antiviral drugs, but only and only under the advice or regulation of a healthcare provider. So another thing you can do is actually taking everyday precautions like the ones I mentioned earlier to protect others while you're sick. So if you're sick, just try to stay in your room as much as possible. Try not to make contact with your family members, because they will also contract the flu, and things can get complicated, things can get serious, and it's very hard if the whole family has flu. So make sure you keep yourself isolated until you're better. And another thing you can actually do while you're sick is to limit contact with others as much as possible. To make sure that you don't infect them, make sure you're always at home. So while you're isolating yourself at home, away from your family members, also make sure that you don't go out unless you need serious medical attention or things like that, because the more you go out, the more you have a risk of spreading it to other people and infecting other people. And like I said earlier, it's always good to use a tissue if you're coughing, you're sneezing, and to cover your nose and your mouth when you're coughing and sneezing, just so it doesn't spread to other people. And as soon as you're done using the tissue, make sure you throw it into the trash after you use it. Sometimes we leave it lying on our bedside table or on our bed, and that is not healthy at all. It can actually increase the rate of infection. So make sure after you're done using it, make sure you throw it. And another thing is, make sure your hands are always sanitized, because like I said, our hands carry a lot of germs, because our hands touch different surfaces, and we don't know if the surfaces that we touch are disinfected. We don't know if they're contaminated. So always make sure you clean your hands. And also, clean and disinfect surfaces and objects that may be contaminated with germs, and objects that you use a lot as well. For example, like your phone, you're constantly using your phone, right? And you constantly keep it in different surfaces. So make sure don't disinfect it. Your phone may probably stop working, but it's always good to put a little bit of sanitizer on a piece of tissue and clean your phone screen with it, right? And something that's very important, something that we've been told a lot, is simply the fact that we should stay at home if we're sick. And if you're sick with a flu-like illnesses, if you're showing any of those symptoms, it's recommended that you actually stay home for at least 24 hours after your fever is gone, except to get medical care or other necessities. And your fever should actually probably be gone without the use of fever-reducing medicine. And unless you're in one of those high-risk groups, if you have pre-existing medical conditions, then chances are, unless you have those, then you'll have to take serious medication. You'll have to be very careful. But otherwise, other than that, you don't really need to take additional medication. You just need to stay at home and rest. So that's what you need to do, and that's all there is on the things you can do, especially if the flu could be a bigger problem than COVID-19 during this winter. So make sure you stay tuned, because I'll be back in a few more minutes to talk to you about anxiety, how to deal with anxiety, and what you can do to control your anxiety, because we are living in a time where a lot of us are anxious, and also people who have been diagnosed with the condition are actually having a really, really hard time. So make sure you stay tuned, because I'll be back in a few more minutes.